Hello everyone, welcome to my channel Physio Patsala. So in the series of biomechanics, we have already completed the introductory part, kinematics, kinetics. Now move further and take the types of kinematics. The first type is osteokinematics and second one is arthrokinematics. In this video, I have covered the osteokinematics. So let's discuss about it. What is that? So in osteokinematics, osteo means joint segment or kinematics means the movement of the particular joint inside the body. It refers to the gross movement of bones around the joint. The joint movement around the particular two bony segments. Like this is my elbow joint, this is radius and this is the humerus. The joint segment is moving around that. This is my axis and the joint segments, and these two or three bones are moving that. So this is my osteokinematics movements. It is clearly visible to movement. So it also in researcher or medical terms or easily understand for the planes and axis in which plane the movement has to be performed and which axis the joint are fixed and the movement around that. It describes the physical movement of the body segment. As you have known, the movement have to be shown by your naked eyes. So it is like flexion and extension of the elbow joint, while a fixed joint or a fixed axis also into the axis is to be a fulcrum and the moving arm is to be movable to the flexion and extension. Movement of the bones related to anatomical position makes sure the person have to be standing into the anatomical position. Take one example. A person who have to be not standing in the anatomical position, and if there have to be like ulnar deviation and radial deviation like that, so the radial deviation now come to be standing is like that, so it is like medial deviation or like it is the lateral deviation, but it is wrong. The anatomical position you have to be standing, and the ulna is to be have to be medial deviation, and radius bone has to be a lateral deviation or outside of the deviation of the into the anatomical position. So these things keep in your mind. So the type of motion in osteokinematics, the types of motion has to be occur. You have to be also differentiate into the plane or axis way in axis. So in flexion and extension is to be shown that in the sagittal plane, and in sagittal plane have body has to be differentiate into left and right side. So this is the person have to be shown, and we have cut down the body into the center way, and the one part has to be there and second part is to be there, and the flexion of the body is to be shown upward, and backward movement is to be shown to the sagittal plane. Next is to be rotation and circumduction. The rotation and circumduction, we have taken the person and they have to be cut their body into the horizontally, or that time the horizontal or transverse cut section into the transverse plane. The axis have to be joint movement shown into the internal and external rotation of the hip joint, internal and external rotation of the shoulder joint in this transverse plane. Next is to be abduction or adduction. Abduction and adduction has to be shown, and take a person who have to be standing into the anatomical position, and their body has to be cut down into the frontal plane, which is coronal axis, into the anterior and posterior. So like that, we have a standing position, we have cut down like that. So the anterior posterior. So the movement have to be shown abduction and adduction into the coronal axis, and the movement have to be shown into the frontal plane in the type of motion of the osteokinematics. A core characteristics of the osteokinematics is bone as a lever. It means bone are the functional part of the lever, and the bone is a rigid structure and the segment, and it will be swinging and performing the movement around the particular fixed axis or fulcrum into the body. Next is to be planes and axis. So already we have covered the plane and axis of the body part, which is a sagittal plane or transverse plane or into the frontal plane. So it's a specific axis is the perpendicular to the cardinal movement will be performed by the particular person. Next is to be degree of freedom. It means a person or a patient in coming your clinic, how much a person perform the functional movement of the particular joint independently without any support. So this is the degree of freedom. Also, we have to be shown the patient have to perform the flexion extension. So in live view, you have to be shown into the anterior view, lateral view, and posterior view, the 3-degree view. But into the online session, you have to be shown onto the all the rotational side. But there is a in the 2D view. Visual observation: a person who have to perform their body movement passively or actively, see by the naked eyes. The osteokinematics has to be work over there, and you have to be shown by naked eyes is performed actively, passively. A flexion extension is to be, range of motion is to be accurate or not. So the surface mechanism also into the visual observation has come under the osteokinematics, which is the core principle of the osteokinematics. Next is to me kinematic chain. It is very important for every physiotherapy for learn and prescribe the exercise of the particular patient. Person to person, it will be changed, it strength and build up the muscle. The first one is open kinematic chain. It means a kinematic movement, which is flexion, extension, rotation, circumduction. This is kinematic motion. It will be performed by a patient into a particular plane or axis, which is sagittal, coronal, or like transverse plane. In a particular axis, a fixed position. So the distal limb of move, it means a person who have to be sitting down into the chair, and their distal segment is to be freely moved and the proximal segment is to be fixed. Also, like dumbbell bell or concentric contraction of the muscle with the dumbbell bell are flexing the elbow. So this is the open chain movement. So the distal limb move freely in the space while proximal segment are stay fixed underlying surfaces. So this the person is to be sitting on the chair, and the proximal, which is hip and knee joint, are fixed and stable into the chair, and the foot is to be freely moved and the flexion and extension performing onto the chair. So if a person is to be suffering from osteoarthritis, from knee strengthening and knee resistance exercise are come under the open kinematic chain if therapists are well understand of the open kinematic chain. Seated by leg extension, foot moves freely, and hip joint is to be stable down. Second one is a closed kinematic chain. It means a person, the proximal segment has to be fixed on the position, and the distal segment, distal segment has to be, or like distal segment meets a fixed underlying the surface. The proximal body segment moves instead. It means a proximal segment um, has to be fixed down, and the distal segment is to be meets a fixed. So a person has to be like performing the squat like that, and their foot has to be supported on the floor, and there is to be fixed. So that is the distal segment. And distal segment meets to the floor and it is fixed. So that is the definition of the distal end of the limb meets the fixed. The distal segment is to meets the floor and it is fixed, and the proximal segment, which is knee and hip joint, is to be performing the action of the strengthening the quads or hamstring muscle for the strengthening on the particular patient if there any kind of weakness and paralysis or paralysis of the particular patient. A squat where the feet remains anchored to the floor. The feet has to be anchored on the floor, is to be fixed down, and the upper body segment is to be moved, which is a closed kinetic chain. So that is the definition of the closed kinetic chain, where the body segment, which is distal part, has to be fixed, and the proximal part has to be moved. Also the biceps, also the push-ups, the person has to be laying down on the floor, and their arm, their hand is to be fixed, their leg is to be fixed, and they are performing the push-ups onto the floor. So their proximal segment has to be moved down, like downward and upward, and their distal segment, which is hand and foot, is to be fixed. So that is another example of the closed kinetic chain. So this is the kinematic chain and osteokinematics. I guess you have to understand very clearly. That is for today. Thank you.